Today I'm going to take a look at Australia's universal healthcare system from its bold beginnings with Whitlam's Medibank to the present day, where debates about its future continue to shape our politics. Specifically, we'll explore Peter Dutton's 2014 Medicare reform proposals as Health Minister and examine a pattern of Liberal Party actions over 5 decades that critics argue have challenged the universality of our healthcare system. This is a story of ambition, resistance, and the enduring fight to ensure healthcare for all Australians. Let's start with 2014, when Peter Dutton, as Health Minister under Tony Abbott's coalition government, stepped into that spotlight with bold ideas to reform Medicare. Dutton argued that Medicare was unsustainable, costing $17.8 billion annually with 263 million free services. His flagship proposal, a $7 co-payment for GP visits, designed to make patients share the cost and curb overuse. He also pushed for greater private sector involvement, suggesting private health insurers could cover GP visits to ease the public system's burden. Wealthy Australians, he said, should pay more, and he extended a Medicare rebate freeze to control costs. Ambitious, yes, popular, far from it. What happened? The co-payment proposal sparked a firestorm. The Australian Medical Association, Labor, and consumer groups slammed it, warning it would hit low-income and sick patients hardest, pushing them towards overcrowded emergency departments. A 2015 poll by the Australian Doctor magazine crowned Dutton as the worst health minister in 35 years, with 46% of doctors condemning this plan. Public backlash forced the government to abandon the $7 co-payment in 2015, replacing it with a $5 rebate cut that doctors also rejected. The private insurance idea fizzled out too, opposed for creating a 2-tier system. But the Medicare rebate freeze? That stuck, lasting until 2018, and it had consequences. Bulk billing rates plummeted from 88% in 2021 to 77% by 2023, leaving patients with higher out-of-pocket costs. Dutton also proposed slashing $50 billion from the public hospital funding over a decade, tearing up state agreements. States and health advocates pushed back, and while the full cut wasn't realised, the perception of an attack on public healthcare lingered. Labor's Mediscare campaigns in 2016 and beyond painted Dutton as Medicare's nemesis, a narrative that stuck. Despite a 7.5% health budget increase in 2014, Dutton's legacy as Health Minister is one of controversy, with reforms seen as threatening Medicare's universal promise. But Dutton's story is just one chapter in a longer saga. Let's step back to 1975 when Gough Whitlam introduced Medibank, Australia's first universal healthcare system. The Liberal National Coalition opposed it fiercely, blocking bills in the Senate and forcing a double dissolution election in 1974. Even after Medicare passed, they challenged its funding in the High Court. This was the first of 10 significant moments where the Liberal Party's actions, critics argue, opposed or undermined universal healthcare. Let me walk you through them. 1. Blocking Medibank, 1973 to 1975. The Coalition's Senate obstruction delayed Medibank's rollout, reflecting their preference for private insurance, which left 1/3 of Australians uninsured before Whitlam's reforms. 2nd, Medibank Mark II, 1976 to 1978, under Malcolm Fraser's coalition government, Medibank was gutted. A 2.5% levy replaced free access, and only pensioners and low-income earners kept free hospital care. Bulk billing was restricted, eroding universality. 3rd, abolishing Medibank in 1981. Fraser went further, and just remember, John Howard was his treasurer, scrapping Medibank entirely. Australia reverted to private insurance, unaffordable for many, leaving 3 in 5 families without coverage and hundreds of thousands without care. 4th, opposing Medicare, 1983 to 1984. And this is once Labor won back government after Fraser. As opposition leader, John Howard vowed to dismantle Medicare for a user-pays system. Public backlash cost the coalition the election, forcing Howard to backtrack. 6th, private health insurance rebate, 1998. As Prime Minister, John Howard introduced a 30% rebate on private insurance, costing $2.1 billion annually. Critics say it diverted public funds to private providers, favouring the wealthy and undermining Medicare. 7th, hospital funding cuts from 1996 to 2007. Howard's government slashed federal hospital funding from 50% to 38% of costs, straining public hospitals and prioritising private healthcare growth. 8th, Abbott's co-payment push in 2014. We've covered Dutton's $7 co-payment, but it was Abbott's brainchild too. Its failure showed the political peril of tampering with Medicare's universality. 9th, Medicare rebate freeze, 2013 to 2018. This was Gillard's policy, but extended by Abbott and Turnbull. This freeze underfunded general practice, dropping bulk billing rates and raising patient costs, hitting low-income Australians hardest. 10. Medibank Private privatisation, 2014. The government under Abbott sold Medibank Private, removing a public check on the insurance market. Critics warned this strengthened private interests at Medicare's expense. These 10 moments paint a picture of a Liberal Party often at odds with universal healthcare's core principle, equal access for all. From blocking Medibank to freezing rebates, their actions, rooted in the belief in market-driven systems, have faced resistance from the unions, doctors and voters. The 1976 Medibank strike, the 1993 election loss over anti-Medicare rhetoric, and the 2015 co-payment backlash show Australians' fierce defence of their system. To be fair, the Liberals argue they support Medicare. They point to record health budgets, $132 billion in 2022, rising to $140 billion by 2025, and claim reforms like the rebate freeze or private rebates were about sustainability. Some policies, like the freeze, built on Labor's decisions, and not every proposal, like rumoured Medicare privatisation, came to fruition. Yet critics counter that Liberal policies often favour private providers and wealthy Australians, creating a de facto two-tier system that erodes universality. What can we learn? Universal healthcare is Australia's third rail. Touch it and you risk political electrocution. Dutton's 2014 reforms, like those before, underestimated Medicare's place in our national identity. The rebate freeze's legacy, higher costs, fewer bulk billed visits, reminds us that even subtle changes can be hit hard. As we look to 2025 and beyond, with bulk billing still recovering and hospital waitlists growing, the debate over Medicare's future remains urgent. So let's ask ourselves, how do we balance sustainability with universality? Can we reform healthcare without leaving anyone behind? Australia's journey from Medibank to Medicare shows what's possible when we prioritise equity, but also how fragile that achievement can be. Thank you for listening, and I hope this sparks a conversation about protecting the healthcare system we all rely on.
Then every Australian, from newborn babe to Prime Minister, can share in the cheapest, simplest and fairest health insurance scheme Australia's ever had.
Medicare.